Looking forward to your retirement? Let's talk about the ways you can make your health insurance work for you. Now, if you're not yet eligible for Medicare, you may want to look into an HSA, which is a health savings account. These are an interest-bearing account that may be available as a benefit with your HDHP or high-deductible health plan. People love HSAs because they offer the triple tax advantage. So the amounts that you contribute towards your HSA are actually pre-tax, therefore lowering your taxable income. Also, these accounts are interest-bearing, and the interest accrued is not taxed. And as long as you withdraw the funds for a qualified medical expense, and the list is extremely long, then there is no penalty or taxation for that either. But it's more than that. You can actually invest a certain portion of your HSA, and the earnings on those investments are not taxed. We've actually got another video dedicated to this topic, the HSA way to becoming a millionaire. I'll put it at the top of the screen. A brief pause here to remind you that if you have questions about your health insurance, you can reach us in the comments below or at the number on the screen. We are licensed nationwide and there is no charge for our services. And please make sure to like and subscribe to stay up to date. Every year, the IRS sets maximum HSA contributions for that year. And in 2024, the max that you can contribute as an individual is $4,150, and for a family, it's $8,300. But if you are older than 55, you have an additional $1,000 catch-up contribution available to you as well. Now, if you're not yet of Medicare age but looking to retire early, then we strongly encourage you to look at a marketplace plan. Marketplace plans offer premium tax credits to those who are eligible based on their income, specifically their MAGI, which is Modified Adjusted Gross Income. Now, if you retire early and are living largely off of your savings or on a rather reduced income, then it's pretty likely that you're going to be eligible for one of these premium tax credits, which can save you thousands of dollars per year. So on healthcare.gov, if you put in your zip code, it will ask you a few questions, mostly about your income and your household size. And based on the answers to these questions, it'll indicate whether or not you'll be eligible for a premium tax credit and how much that premium tax credit might be. Now, of course, you can skip these steps, but then you won't get any information about that premium tax credit. That is very, very important. So let's put in that it's us and other people. We will put in that we're married. You claim any dependents? Yes. Let's say we're going to claim 3 children. Continue. All right, let's say that we are a 35-year-old male and none of these apply, not eligible for health coverage through a job because then you would be ineligible for a premium tax credit most likely. We said we're a legal parent or guardian, not pregnant, not a tobacco user. Continue. Okay, and let's say married to a 30-year-old female, none of these, skip. And let's say we have a 7-year-old male, none of these, continue. A 5-year-old male, none of these, continue. And a 3-year-old female, that should do. Okay, all right. I accidentally put in 25, but it doesn't matter. Let's confirm that that is in fact our household. And now let's estimate our household income. Let's say that our family of 5 makes $125,000. Based on this income and household information you provided, you may qualify for an estimated premium tax credit of $900 per month. All right, let's go back and try a slightly higher income. Based on this information, you may be eligible for a premium tax credit of $608 a month. Let's go back and try a lower income. Let's try $90,000. Based on this income and household information you provided, you may qualify for a premium tax credit of $1,352 a month. Let's look at the plans just so you can get an idea. Okay, so based on this income that we put in, there's actually plans available to us with no premium after our premium tax credit. Bronze plans, so you can see. So really it is entirely based upon your income, your household size, but you can see that this can really save you a significant amount of money on a yearly basis. Now, on the flip side, you may not be retiring early. You may actually be working past the age of 65. And if that's the case, you're going to want to go ahead and defer Medicare Part B. Follow the instructions on the back of the card and send it back. Because if you keep the card, you keep Medicare Part B, and you will be charged for it. And there's really no reason to pay for 2 forms of the same insurance if you're receiving creditable coverage through your employer. So if you are working past the age of 65, once you do retire and you're ready to re-enroll in Part B, make sure to contact Social Security rather soon. That way you can avoid that Part B late enrollment penalty. So the Part B late enrollment penalty is 10% for each full year, each full 12-month period where you could have signed up for Part B but didn't. So let's say you waited 11 months but didn't make it the full 12 months, well then you wouldn't have that penalty. If you waited anywhere between 12 to 23 months, you would have an extra 10%. Once you reach 24 months, it would be 20%. So for each full 12-month period, add on an additional 10%. And this is not a one-time penalty. It gets tacked onto your monthly premium forever. So here's the example that they give below. If you waited 2 full years, so at least 24 months, and you could have signed up for Part B, but you didn't, and you didn't qualify for a special enrollment period, then you have 2 times that 10% penalty. So that's 20% of the base Part B monthly premium, which is $174.70 in 2024. So 20% of that is $39.94. Add that to the base premium, and now your premium would be $209.60 as opposed to $174.70. And at that point, you're likely going to want to file for IRMAA as well. So this is the IRMAA form, also known as the Medicare Income-Related Monthly Adjustment Amount Life-Changing Event Form, or SSA-44. Basically, Medicare is looking at your taxes from 2 years prior to determine whether you need to pay an additional amount on top of that base Part B monthly premium. However, it's likely when you retire that your income will decrease. But Medicare is looking at the information from 2 years ago. So it's possible that you could be paying additionally on top of that regular premium without the need to. Basically, if you are single and you are now making less than $103,000 and you were making more than $103,000 before, or if you are married filing jointly and you were making more than $206,000 before, then it's definitely a good idea to go ahead and file this form. That way you don't have to pay those adjustment amounts. There are a few prescription drug options that you should be aware of, although of course our number one recommendation is Part D. Now the truth of the matter is, even with Part D, some medications can be extremely expensive if we're talking about those higher tier or specialty medications. Because of this, sometimes people feel that Part D just isn't worth it. However, there are other benefits of having Part D. For example, Part D offers the catastrophic coverage phase, and of course, if you don't enroll in Part D, when you do choose to enroll further down the line, you may be subject to a Part D late enrollment penalty. Let's start with the catastrophic coverage phase. So if you're someone who does take some of those more expensive, higher tier medications, then the catastrophic coverage phase is very, very important. It's designed to help you limit your medical spending, although your prescription drug spending will still likely be more significant than you had hoped. So the catastrophic coverage phase in 2024 is actually different than in years past. In years past, once you reach the catastrophic coverage phase, you would be responsible for still 5% of the prescription drug's cost. However, starting in 2024, if you reach that threshold, which in 2024 is $8,000, then there is no additional charge for any of those medications for the rest of the calendar year. So this is very important for people that have higher tier medications that have more significant prescription drug spending, because that can save you a significant amount of money. Some of those prescriptions are hundreds of dollars even when they're covered by your insurance. Now, not enrolling in Part D and then choosing to do so later down the line could also make you susceptible to the Part D late enrollment penalty. So if you go for more than 63 consecutive days without creditable prescription drug coverage, then you may be subject to the Part D late enrollment penalty. Now, it is nowhere near as significant or large as the Part B late enrollment penalty, but it's still something that you should be aware of. And basically, after you've reached that 63 days, it would be 1% for the national base beneficiary premium, which is $34.70 in 2024. And that's for each of the months after 63 days that you don't have Part D or creditable coverage. So if you went 2 months, it would be 2%, 3 months, 3%, and so on and so forth. And here's the example that they provide. So in this example, Miss Martinez went 29 months after that 63 days without creditable prescription drug coverage. So it would be a 29% penalty. 29% of $34.70 is $10.06, which they round to the nearest 10 cents, so $10.10, and that would be on top of whatever her Part D plan is that she chooses to enroll in. So again, it's not extremely significant, and some of those Part D plans are, only a couple of dollars per month. Could be $10, $20, $30. There's more expensive plans as well. But plenty of the Part D plans are rather inexpensive. And the Part D late enrollment penalty isn't rather significant, but it is still something that you should be aware of. Now, in all honesty, as you've seen, it's not a rather significant penalty, certainly not when compared to the Part B late enrollment penalty, but you can still choose to avoid it entirely by enrolling in a Part D plan. And you can even enroll in one of the less expensive Part D plans to offer yourself some coverage and protection against that late enrollment penalty. This is again Medicare.gov. This time I put in a New York zip code because the plans available are based on your area. Other zip codes that I put in have plans that actually have no monthly premium. But right now you can see that there's a plan available for $3.70 a month. And like I said before, I put in, here I will show you. Let me go back and put in a different zip code. I'm going to put in a North Carolina zip code again. We're looking for Part D, find plans. We're going to put that we don't get help with any of these programs. We're not going to look at prescription drug costs right now. But again, you're going to see that there's actually a plan available that has no monthly premium. So if that's the case, if you live in an area that has plans that have no monthly premium, why wouldn't you enroll in a Part D plan? If you're somebody that doesn't even take medication, and very often that's what we encounter is people say, I don't take any prescriptions. Why do I want to bother enrolling in a Part D plan? Well, because you never know if you might need to take a prescription, number one. And number two, enrolling in a plan will help you to avoid that Part D late penalty, which we said isn't much. But if there are plans available in your area that don't even charge you anything, why not enroll in one? And then even if that's not the case, like I looked in New York and it had a plan available for $3.70. And if you were to do the math, it would actually cost you less to enroll in one of those less expensive plans than to end up having to pay a late penalty for a period of at least 12 months. There are also pharmaceutical assistance programs and state pharmaceutical assistance programs if you still wish to delay enrolling in Part D or even use these programs in conjunction with Part D. You've probably actually noticed pharmaceutical assistance programs at the ends of those prescription drug commercials where they say something like financial assistance may be available. Those are generally speaking the pharmaceutical assistance programs, and they are available for certain prescriptions, sometimes based on your income. And some states also offer state pharmaceutical assistance programs. So this website is great. It has a list of all of the state pharmaceutical assistance programs as well as the discount prescription programs. So you can see that actually at least 48 states have a state pharmaceutical assistance programs, and then 13 have state discount programs. So the odds are pretty good that there may be something available in your state. Now, very often these are specific to either conditions or ages. For example, the Alabama AIDS Drug Assistance Programs, and then there's also Senior RX. Which is very helpful if you're somebody that is of Medicare age. Also, if you want to take a look at the discount prescription drug programs, those are more generic. And sometimes, for example, the Florida Discount Drug Card Program, that can be used not just in Florida. So definitely take a look at this website, ncsl.org. I will put a link in the description below. Just scroll on down, take a look at your state. Also take a look at those discount prescription programs because, like I said, something like the Florida Discount Drug Card Program, those discounts can be used out of state as well if you're traveling. This is in addition to things like pharmacy coupons and programs like GoodRx. So you can definitely do your research, comparison shop to make sure that you are getting your prescription for the lowest possible cost. Health insurance in your retirement is just going to cost money. There's really no way around it, but you want to put your money to its best use. And there are basically three main options you can go for with regards to your Medicare coverage. You can choose to just enroll in Original Medicare alone. You can enroll in Original Medicare plus a Medigap plan, or you can forego Original Medicare entirely in favor of Medicare Advantage. So like I said, we have Original Medicare, which can work with a Medicare supplement plan, also known as a Medigap plan, Or you could choose to replace Original Medicare with a Medicare Advantage plan. So you can't have Original Medicare and Medicare Advantage, and you also can't have Medigap and Medicare Advantage. Original Medicare has no out-of-pocket maximum, and that's where Medigap plans can really step in to fill in, because very often Medicare supplement plans will offer an out-of-pocket maximum. With Original Medicare, there's Part A and Part B, and your Medicare premiums determined by your work history and your income. You would continue to pay for those, but in addition, if you do choose to supplement with a Medicare supplement plan, then there's an additional monthly premium, which is determined by the plan and carrier that you choose, as well as your location, and you may have to undergo medical underwriting, in which case you could be charged more or just denied for a Medicare supplement plan. Of course, you can't be denied for Original Medicare. Original Medicare has set deductibles, copays, and coinsurance. Part A will, generally speaking, have a copay that is determined by the type of facility, whether it's a hospital or a skilled nursing facility, and your length of stay. And Part B, generally speaking, has a 20% coinsurance. Again, that's where Medicare supplement plans, Medigap plans, fill in those out-of-pocket costs. So they will help to pay for your deductibles, copays, and coinsurance, or they may pay them completely. And those benefits and costs are going to be standardized with Medicare supplement plans. Original Medicare doesn't offer dental, vision, hearing, or prescription drugs, and Medicare supplement plans don't offer those either. However, Original Medicare doesn't require referrals or pre-authorization, and there is no networks. It's the same thing with the Medicare supplement plan. Regardless of who your carrier is, because these plans are offered by private carriers, if your doctor accepts Original Medicare, they accept your Medicare supplement plan. Now, that's just not the case with Medicare Advantage plans. These work on networks, and sometimes those networks can be rather restrictive. Now, you do have the option to enroll in a PPO as opposed to an HMO. If you enroll in an HMO, you would need referrals. If you enroll in a PPO, you don't. But there's still the issue of pre-authorization because these are managed care plans. That means that not only does your doctor have to approve a given service or treatment, but so does your carrier. Now, some of the good parts of Medicare Advantage is that they offer out-of-pocket maximums. Very often, they have lower copays, deductibles, and coinsurance than Medicare alone or Medicare supplement plans. Also, they often offer additional benefits, things like dental, vision, hearing, prescription drugs, sometimes transportation, fitness, etc. Additionally, these plans don't require medical underwriting, regardless of when you choose to enroll. So if you found any health insurance savings hacks that have really helped you in your retirement, please let us know in the comments below. Of course, if you have questions about your Medicare coverage, you can reach us there or at the number on the screen. There is no charge for our services, and we are more than happy to help. As always, thank you so much for watching and have a wonderful day. Bye-bye. If you want to learn more about the most popular Medicare supplement plan, make sure to check out this video up here. And please don't forget to like and subscribe. We'll see you next time.